Shock topic only. What are the systemic effects? So almost all the systems of the body will get involved in the shock, that as an effect of shock. So the outcome is shock, problem is shock, and how all the organs are going to involve, we'll see. Like suppose there is hemorrhage and fluid loss, extracellular fluid volume deficit, intracellular fluid volume deficit, you have studied, no? And bleeding causes hypovolemia, cell anoxia. As the cell get anoxia, because of decreased fluid volume, there will be heart failure, because myocardial valve, there will be heart failure, and decreased cardiac output, decreased perfusion state, and the cell become anoxic and they get into shock. And also certain diseases like myocardial and valvular diseases, right? They also, when they have there is a heart failure, there will be decreased cardiac output, decreased blood pressure, decreased perfusion of tissue, and there will be cell anoxia and shock. And neurogenic, like in case any sepsis, any infections, and anaphylactic shock, anaphylactic reactions, what happens is there will be, these are all called to be neurogenic impulses, which causes vasodilation. Instead of we have seen normal artery, constricted artery, dilated artery, right? The space, if you examine, you will understand this is dilation, vasodilation, then heart failure, decreased cardiac output, there will be hypoperfusion, anoxia and shock. And as the anoxia develops, there will be release of cytokines and even pressure, there will be acidosis also, there will be acidosis. And in cell anoxia, development of thrombosis and hemorrhage also develops, which causes thrombosis, causes edema, whole body swelling. And some of the symptoms of shock is the severe hypotension. When you take a patient with the shock, you can observe when you take their blood pressure, severe hypotension. Their body will be cold and clammy skin because there is less perfusion, and the body will be swollen because cellular edema, cell becomes swollen, cellular changes we have discussed now. So because of that, edema is observed. Why? Because there is thrombosis and hemorrhage. And somnolence and coma, they are not going to be in normal conscious state. And related to kidney, there will be oliguria. Oliguria means decreased renal urine output. And related to lungs, they develop dyspnea. They will be unable to take normal respiration. And gastrointestinal, related to that, GI bleeding, paralytic ileus also observed. And as a patient get into shock, there will be acute respiratory distress syndrome, finally death due to cardiorespiratory failure. The heart fails as well as lungs also fail to work. These are the normal systemic effects. And persistent compensatory vasoconstriction is seen here in the picture, right? Dilation, vasoconstriction, peripheral, persistent compensatory vasoconstriction, persistent vasoconstriction. Vasoconstriction, why this vasoconstriction is going to occur? In order to increase the blood pressure, circulatory volume, in order to increase the circulatory volume as a compensatory mechanism. And another thing is dilation in circulation. There will be dilation in microcirculation, and there will be decrease in venous return. So, the venous blood return will be less, decrease in cardiac output, right, this is what noted. Decrease in arterial blood pressure, because cardiac output is decreased, there will be decreased arterial blood pressure. Then decrease in tissue perfusion we have seen, right, and decrease in venous pooling, decrease in venous pooling, decrease damage to microcirculation, because dilation, as the dilation continues, there will be damage in microcirculation, increase in pooling of blood in microcirculation, and cellular hypoxia, that is cell anoxia, affects release of vasoactive substances. They release, the cell anoxia release vasoactive substances, and increase in metabolic acidosis. That is the reason why patient is present with the metabolic acidosis. That is what we have seen here, metabolic acidosis. What acidosis is? It is not respiratory, metabolic acidosis is going to develop in the shock. These are all the various effects, almost brain, heart, kidney, lung, GI system is involved. These are the major effects or systemic effects of shock.